So let me formally welcome all of you to University of California, San Francisco. I am so excited that we are the hosts of this forum, and I want to really give all the credit to Haile for his wisdom, his great heart, and his enormous enthusiasm for global health. UCSF's leadership in global health is in no small part due to your leadership, and I salute you for that. So I am most happy and proud of the role that you and UCSF are playing in global health, and thrilled that we're the lead planner and the administrative core for the UC Global Health Institute that is not just UCSF, but UC-wide, which I think is really extra special. Let me take a few minutes to give you all some sense of the scope of global health at UCSF, because it is vastly different than when I left with my husband for Uganda now 20 years ago here at UCSF. UCSF researchers have funded research projects in more than 100 countries, and more than 400 faculty leaders have been involved in extramurally funded international programs. So there's a lot going on at UCSF in global health. Some of the examples are the Proctor Foundation's treating trachoma on a community-wide scale and monitoring the effects over time to find the best treatment recommendations. In Vietnam, UCSF affiliates are working to develop epidemiology training in the Hanoi School of Public Health. In Tibet, medical anthropology is exploring the interface between Tibetan and Western medicine with an eye to improving health. In Brazil, Global Health Sciences program is aimed at training scientists in AIDS prevention research with a goal for self-sufficiency for research scientists capable of designing and implementing AIDS prevention research independently. Very important work. Our affiliates in Bangladesh work to identify methods to contain the spread of infectious diseases. Our affiliates are working with the Clinton Foundation and ExxonMobil and the Bill and Melinda Gates Foundation on malaria elimination. And last but certainly not least of the things I want to highlight for you, UCSF started the first Masters of Global Health Sciences degree program nationwide. So one of the great joys I've had in coming to UCSF now a little over 3 months ago as chancellor is learning about events going on campus. And it has been really remarkable to learn about the scope and the excellence of the efforts in global health. Absolutely thrilling. Now, a couple weeks ago, I outlined for the campus my priorities in a town hall meeting. So I'll give you my top 5 list. As you all know, we have a wonderful mission and vision here at UCSF, all about advancing health worldwide. So my priorities are patients and health, number 1, discovery, education, people, particularly management and diversity, and the business of UCSF. And as I was thinking about my comments here this afternoon, I will say that the global health effort really touches on each and every one of the priorities I have for the campus. I want the work that we do at UCSF to matter even more for the world than it does today. And when I think about the future and the importance of global health and the efforts that you're all here to talk about today, it just thrills me. We're going to make a difference in the world. So I'm extremely happy that you're here and participating. Now, I'm between you and the most important event of the afternoon, which is the student panel. And students are really interested in global health. Let me give you a few statistics. Over 75% of UCSF students have traveled abroad, and that's abroad for a reason other than vacation. Our students care about global health. 50% of UC undergraduates who were surveyed said they were interested in completing a major or minor in a discipline that studied global health challenges. There's been a 100% increase in student enrollment nationwide in global health programs from 2006 to 2009, and 11 new academic programs have opened since 2007 in global health. One of the most important things to me is one of my jobs as chancellor is to be an advocate for UCSF and an advocate for the health sciences efforts we do here. So some part of my job is thinking about our pipeline of talented, diverse students who we want to be interested in health sciences. And it is far easier for me to interest students in health sciences by talking about global health than math or physics or chemistry. Many of the students think that's kind of boring, including all my own nieces and nephews who say, Aunt Sue, just because you liked math, my mom and dad think I will. I said, no, don't worry about that math stuff. Think about the impact you could make on the world by being an expert on health sciences. So I'm most excited about global health because of what it means for the future and what it means for us in attracting talent, which is a big part of who I want us to be. For me personally, selling our Honda Civics, which Nick and I had at the time, subletting our flat on Potrero Hill, and moving to Uganda just after all the trouble, as it was called, in Uganda in 1989 was a life-changing experience. So I am particularly passionate about how big a difference not only involvement in global health can make on the world and health worldwide, but just as importantly, how much for a single human being, your own sense of what you're capable of and the contribution you should be making really changes with a good experience, as I had, I think, in my time here at UCSF. So I am particularly pleased to be here today. I thank highly for the invitation to join you, and I hope you will enjoy the student panel because that's really why we're here, is to think about what's the future of global health and what's the future of providing the kind of environment and the education and the training and the experiences that are going to drive us to have great future leadership in global health. So welcome to UCSF, and I hope you enjoy the rest of the afternoon. Thank you.